Julie.
Hi, how are you, Holly?
I'm good, thank you. How are you?
I'm fine, thank you.
I like your snazzy background. We're matching.
Yes, snap. I wonder where I got it from. But it's important, it's the Remember campaign, and the posters are amazing around the trust, aren't they? I really like the 2 metre one, so you can work out what 2 metres is.
It's long, isn't it? I didn't realise
it is.
how long, 2 metres
I
long.
know, and that's the other thing, isn't it? Anyway, we're not here to talk about the Remember campaign. We're here to talk about COVID vaccines, which are obviously very important.
They are, and in fact, it's really interesting. I was just saying to you before we started recording, we're getting a lot of questions come in about them. So we wanted to ask some of them. We've sort of themed them up a little bit, so I can put them to you. But yeah, you ready to rock and roll?
I am, yes.
Right then, here we go. Okay, so the first question we're getting a lot of is about having the vaccination, but also having allergies. So lots of people have been coming through telling us that they've got allergies and asking whether or not they should have the vaccine. What are your thoughts, or what's the guidance on this?
Well, I think to start with, before I answer that question, just to say for everybody, there is frequently asked questions now available on the staff room, which have come out of some national questions, but also have come out of the question and answer sessions that we've been doing, Itai, HR and Workforce and myself. And one of them has been around allergies. So actually, people will have heard about the Pfizer vaccine and not having the Pfizer vaccine if you've had a severe allergic reaction like an anaphylactic shock, or if you're using an EpiPen. And that's the Pfizer vaccine. There are other vaccines out there, obviously, but the guidance is that actually when you go for your vaccine, the part of what happens is you will be asked about allergies. Like with any medication, the clinician will ask you about what allergies have you got. Our staff have been trained around that area. But if you've got any concerns, please take advice from your GP, your medical practitioner, because they know you best. And they will go through it on an individual basis for you as well. So I hope that asks the question. But just to say, back on the frequently asked questions is a link to all the 3 types of the 3 vaccines that have been approved by MHRA, and it takes you into each of the data sheets and it tells you about this sort of thing there as well. So it is important. The frequently asked questions are a really good place to go because they've got the most up-to-date data sheets on all the vaccines.
Perfect. Okay, so we will link through to make that as easy as possible to find. So that's exciting. Oh, I like a frequently asked questions sheet. Perfect. Right, okay, so next up, we've got a question about whether or not the vaccination, once you've had it, will it be added to your medical record automatically, or do you need to let your GP know?
Right, so when you go for your vaccine, it's important that you take your NHS number with you, because that is the number that links it through to your GP. So yes, it does link through, but you need your NHS number. And if you haven't got your NHS number, your GP practice is the place to go. It is really a good number to keep nowadays. We're being asked for it more and more. So I think everybody should have that number now. Certainly I have, and I've saved it on a safe place. It's a bit like a password, really, isn't it?
It is,
That is an important number. You keep that number for life. But that will link your records through, and that is the idea of having your NHS number, and it will link it through.
Perfect. I know that I needed my NHS number previously for something last year, and my GP's got like an online portal which I could just log into, and it was there. But I also know that the lady on the reception for my GP also helped me find it. So I just rang up, but I don't know where it is. So it was really helpful. So there are ways to find it out if you don't know what it is.
Some GP practices have the system one that you can access as a patient, and it will be on there. So that's a really good point. If you've got access to system one through the app or from the through the web, then your NHS number will be there.
Okay, so cool. Okay, that's really helpful. Next up is, when are the next question and answer sessions happening? So sessions that you spoke about earlier with Dr. Itar, yourself, HR, Workforce, when are the next ones?
So I can't give you the exact date. We're doing a couple a week, but it's on the staff room. You know, this sort of level of information is on the staff room, and we're going to be doing some specific sessions for our BAME colleagues as well.
Oh, cool. That's great. That's brilliant. So, perfect. So you can find those dates on the calendar that's on the staff room. So again, we'll pop that in the article below so you know where to click to find the dates and times. Okay, perfect. Next up, and the last question I've got for you is, if I've had my COVID-19 vaccination, the first dose of it, do I still need to do lateral flow testing?
Yes, please. So if you're a front-facing member of staff who's doing lateral flow, it is important that you continue to do your lateral flow. And some of you will be coming to the end of your lateral flow packs. And this has been recognised nationally. So James Mullins, who leads on lateral flow in the trust for us, has been asked nationally to provide numbers of how many more packs we need. And nationally, they're looking at phase 2 rollout of lateral flow. And we hopefully, if they are going to do it, and we'll keep you up to date and what's happening, we will receive them in the next couple of weeks. And we will be sending them out on a named basis. So we will be using the database that we have of people doing their lateral flows as a way of getting the packs out. So my plea to everybody out there is, please make sure that you are recording onto the lateral flow database, the test, and it's on all our front screens. So you'll see a little white logo with a little black jar with some bubbles coming out of it, and it says lateral flow test results. Click on there, follow it through and fill it in, and you can actually use that link and transfer it to your phone. So a lot of us have now got it on our phone, on our iPads, so you can do it anytime, any place, and it is important that you do fill that in, please.
Perfect. That's super, super helpful. So those are all the questions that I've got for you today. We did try to theme them up a little bit just because of how many we have coming through about COVID. So the allergies, the medical record questions. So again, we'll point towards that frequently asked questions document. Is there anything else you've got to say?
Yeah, there is, you know, so we are vaccinating our staff at the moment. We're also doing housebound and care homes. We're involved in those projects as well. And there's a piece of work going on in the county looking at, you know, other client groups. So obviously we've got some long-term patients in mental health, and how do we do that? So that piece is being looked at as a county-wide, and I know Jean, our COO, is involved in that work. So watch this space for further information if you want information in your patient group. But I think the other thing to say about the staff is, you know, we had a lot of people put the expressions of interest forward, and if people still want to make an expression, the form is still available. It's on the staff room. But the other thing is, if members of your team have got their appointment, they are making their way down the list. You know, it was about 3,500 staff came forward, so we are working our way down based on risk. So if you think your team's been done, you haven't, you know, you will get an appointment. It's just the way that the list is being managed. It goes into a massive spreadsheet, and people are working their way down that list. So over the next couple of weeks, you know, you will get your appointment and you will get your vaccine if you've not had it yet.
Perfect. Now that's really helpful. And just before I ask if you've got anything to say to Team NHFT, we're filming this on Monday the 18th, and it's Blue Monday today. I know that not everyone agrees with Blue Monday as a concept, which is absolutely fine. But what we wanted to do was raise awareness of the fact that every day is mental health, not just Blue Monday.
That's
so
it.
At this present time, so at 3:39, there is an event going on led by our governors and our foundation trust, which will be available for you to take a look at. There's also 10 top tips for wellbeing on the staff room, which I hope you guys check out. And from sort of the people who've been involved in that, I hope everyone's looking after themselves. And Julie, have you got anything else to say to Team NHFT before we sign off?
A big thank you, actually. You know, it's a difficult time. It's post-Christmas. This is also always a difficult month, isn't it? Post-Christmas with the weather out there. It's not a particularly nice day again today. The sun's not out. It was out yesterday. But you know, your well-being is really important. And even in the middle of a pandemic, even more in the middle of a pandemic, you've got to get some sort of work-life balance. You know, I know we can't go very far. We can't book our summer holiday. You know, we can't do any of that. But it's important that you get some exercise in, that, you know, spend some family time, you know, and eat healthy. It is really important that we look after each other, look after each other's well-being. So please keep safe. It is known as Blue Monday today, but that's all do our best to look after each other. You know, well-being is important. Our mental health is important. You know, it's a part of our whole. It's not, it doesn't stand on its own. It's part of our whole. So look after each other, keep safe, and a big thank you for all you're doing.
Thank you, everyone. And next week I will be back with another Ask a Director, and this time I'm going to have the lovely Dr. Itai on with me. So very excited about that. And keep your questions coming in. I love to see them. And thank you, Julie. See you later. Bye.
Bye.